And I used to be very disenchanted seeing patients in the office because I didn't see them improving at all. I didn't see their blood pressures improving. I saw them becoming more obese, more diabetic. And even though their LDL would drop, I could never correlate that LDL with any improved outcome in my patients. So it was only through like a personal experience that I found a low carb diet. I started looking into metabolic health. And what it was is that you see me about 145 pounds in front of you. You see my bicycle in the background. So I belong to a racing team. And even though I was never particularly heavy, I was up to about 175 pounds despite cycling about 1,000 miles a month. And I couldn't explain why am I getting heavy? And so one day I was listening to this podcast and some information that Chris Froome, who was doing very good in cycling at that time, he's a Tour de France cyclist, that he was a low carb athlete, that he improved his power to weight ratio, which means that the amount of power he can put for his own weight was quite high, and it improved with a low carb diet. So I said, let me try this. And within a few months, I was down to 160 pounds. But since then, I've come down to 145 with further fine tuning as I learn more. But I said, if this is so easy in me, why am I not trying it in my patients? And so I've pulled myself away from the cath lab. I've hired a couple of colleagues who do my procedures. And I spend the bulk of my time counseling patients. And it's a learning experience. I learn every day. When a patient listens to my advice and he loses weight, his blood pressure gets better, his sugars get better, he comes off diabetic medications, he comes off blood pressure medications, he feels better. That is such a strong validation for him that he goes and tells many of his colleagues saying that, hey, there is this doctor who's doing something different. So being relevant, being somebody who can actually improve somebody's health is such an important aspect. I'll just give you a small example. Cardiologists feel very good about themselves when they can alter somebody's cholesterol. So you give a statin to somebody and their LDL levels are 150. They come back in 2 months on a statin and their LDL level is 70. And both the patient is looking at a number and the cardiologist is looking at a number, and he says, hey, this is fantastic. Look how much we have improved your health. Except that I think that they are looking at the wrong marker. I think for me, the transformative experience is not looking at a number, but looking at seeing, hey, is this guy feeling better because his blood sugar is lower? Are his joints hurting less because he has lower weight? Is his blood pressure better? Is he having to spend less money buying medications? So I think those are better surrogate markers than a blood marker. And it takes time for physicians to do that critical thinking. And I really find that surprising about my subspecialty, cardiology, interventional cardiology, because we have been focusing on cholesterol, which is, I think, the wrong thing. I think cholesterol is more or less a surrogate marker for insulin resistance. And we should be focusing on quality of cholesterol, which is an indirect indication of how good your metabolic health is. And I am frankly surprised that my colleagues have not gravitated towards that and then still cling on to this lipid, heart hypothesis, which cannot be more wrong. A typical cardiology consult is that, Mr. So-and-so, your stress test is good, your ultrasound is good. Let's go up a little bit on your cholesterol medicine. Let's increase your blood pressure medicines. And by the way, eat a low-fat diet and exercise, and I'll see you in 6 months. 30 seconds.